There's been a lot of questions regarding testing for COVID. I'm Angie Caliendo. I'm the Executive Vice Chair of the Department of Medicine at the Warren Alpert Medical School. I'm also the Vice President of Brown Medicine and the President of Brown Physicians. We see patients that are hospitalized with infections, any number of infections, and some of those patients do indeed have COVID. And I wanted to spend a little bit of time explaining and providing some background on what influences the accuracy of the result that you get from a COVID test. So let's talk first about the test. And there's two general types of tests. Tests that detect the virus itself, and that's what we're using right now for diagnosing. There's also serology tests that are right now best used to answer the question, has this person been infected with the virus or not? And it's a blood test. There's been a lot of talk and a lot of excitement about this rapid test. That is a test that detects the virus, and the time to perform the test is about 15 minutes. And so this has raised a lot of interest in using this test because you can get the results so quickly. The other issue is the specimen type. If you're relatively mild to moderate disease, people are going to collect what's referred to as a nasopharyngeal swab. So they put it back into the back of your nose and up into your nasopharynx. The better quality the specimen, the better performance of the test. If you just use it at the end of your nose, you're not going to get nearly as much virus as you will if you go back into your nasopharynx. As people become more ill and are hospitalized and put on a ventilator or a breathing machine, we have other methods of getting a deeper sample in the lung where there is a higher concentration of virus. I think a combination of having adequate testing so that you can test symptomatic people in quarantine and having antibody tests so we know which people in the population have been infected and have not been infected, those two factors together are going to be very helpful in getting us out of this social distancing situation and back to work. I think access to testing will certainly help the decision making in that process.